Dr. Toman, Kevin, hi.
Dr. Dobias, Peter, how are you, sir?
We can possibly call each other just Peter and Kevin. I think that it's going to be easier. And even for the community.
Kevin works for me.
I'm so glad to be here with you. I've been looking forward to this conversation for a long time, mainly because it will be about what so many dog lovers and pet lovers look for, and that's longevity and health span of our animal friends. So could you tell us a little bit about your background and what inspired you to become a vet who focuses on quality of life, health span, and being what I would call a very progressive veterinarian when it comes to using innovative and non-traditional treatments?
Well, first off, thank you very much for the opportunity to appear on your podcast. In answer to your question, I graduated from veterinary school at UC Davis back in the dark ages of 1986. And much like you, I was in clinical practice for over 30 years in California, Colorado, and then back again to California. And during that time, I practiced in some rural areas. And so I saw some of the more complicated cases, from orthopedics to cancer care, et cetera. And one of the things that always frustrated me was the limited options that were available to people, especially in some of those more rural areas. As my time in clinic evolved, I learned from many of the mistakes that I made, but also from people much smarter than I am, that comprehensive veterinary care, or the best in veterinary care for pets, takes many different forms, not just vaccine, not just surgical, not just steroids, but also herbal therapy or acupuncture or laser, as the case may be. And I think that in general, pets, like humans, are best served by being able to pick and choose the different medical approaches that you use to their health. Yeah, I think that the more we restrict an individual to a particular type of healthcare, the less satisfactory the outcome is going to be.
So in your journey as a vet, what have been some of the key moments and experiences that shape your approach to animal health and wellness?
Well, I think that number one, I've learned from all the mistakes that I've made along the way. But as a result of those mistakes and of the clinical interests that I developed, I really came to be fascinated about both orthopedic and cancer care. Those were two early drivers to my career. And if you look at the Venn diagram that those two circles overlap, the common area in the middle is geriatrics, or the care of the older patient. So that really became a focus of mine. And I'm 63 years old, and so I've had a couple of health challenges along the way and learned that traditional medicine or traditional veterinary medicine does not always offer all the alternatives that are available. When I looked at those cancer patients, or when I looked at the chronic orthopedic patients, I just felt like grabbing options from different bags, so to speak, was the best way to treat these pets.
That's what's called integrative care, right? We integrate and we combine things.
Well, that's my definition of integrative care, but I've been asked to split hairs on that because some people would define integrative care as separate and distinct from allopathic or from traditional care. Where you have and I'll use Rimadyl and steroids on one side of that divide, and curcumin, or whatever the case may be, boswellia on the other side. And to me, integrative approach, truly defined, means using both when they're appropriate, or sometimes using neither when they are appropriate. I try very hard not to draw a distinct line between allopathic veterinary care and what is commonly phrased as integrative or holistic care. Typically, I start drawing a big circle, Peter, with a bunch of inward-facing arrows. And the more of those arrows that I can draw from, I think, in general, the better the outcome for my patients.
Well, it makes sense. Integrative comes from the word integration, and integration means combining the different parts and making the best use of them, right? So what is unique about your veterinary practice, especially regarding holistic treatments, and how does it differ from the more traditional veterinary practices?
That's kind of a loaded question. I think I have a bias here, and let me explain that bias. As a veterinarian who graduated back in 1986, as I said, for many years, I was taught that annual vaccines, for instance, were a requirement for a healthy pet. Early spays and neuters, for instance, were in a pet's best interests. And what I've learned through time is that the realities of veterinary practice are sometimes driven by true healthcare for a pet, but other times there are different agendas. There's the economics agenda, trying to conform with what everybody else is doing. There's a little bit of competition thrown in for good measure. And what I decided to do was that I wanted to concentrate specifically on the care of the aging pet, in particular, how to extend their life, or as Peter Attia describes, their health span, which I think in general terms would refer to quality of life as opposed to quantity of life. And I think veterinarians day in and day out do a great job of vaccinating pets. I think they do a great job of sewing up pets after a laceration or pulling porcupine quills out of a dog's face. And I've done all those things. But I don't think we pay enough attention to how to help pets extend their life or extend their quality of life to an optimal degree.
I fully agree with you that sometimes it seems that we have kind of omitted part of the practice or part of the practice of medicine and just focus on what is relatively simple or what we are used to and not really exploring enough, especially in the areas where there is no financial benefit. I get sometimes frustrated to see that research is very one-sided, that the aspects of research that could be very useful but not very profitable in quotes are forgotten or put aside. So what are the most common challenges that you face in practice and how do you address them?
Well, so one thing, I believe that the best in veterinary care, Peter, for any pet centers around building a relationship with your local veterinarian. I want to be absolutely clear about that. I think that the veterinary profession, for all of the flaws that I manifest, the reality is that I think that a veterinarian well chosen is a great partner in a pet's veterinary care. I'm going to answer your question in kind of roundabout fashion because, as you and I both know, pets of different breeds have different health risks. And so people contact me and they want this pill, they want a supply of rapamycin, for instance. And I'm sure we'll talk about that. But many times they're omitting the simple things that would help their pet live a long time. The dental care in these dogs that are under 20 pounds of size, or in cats as well. The orthopedic or the obesity care of the larger pet. I think that traditional veterinarian has a large role to play in terms of the comprehensive dental care of a small dog, the orthopedic or the overall health care of a large breed dog. I do a number of consults with people from more rural areas of the United States in particular. And many of those pet owners have all the care and sometimes all the finances in the world, but no way to really address the overall needs of their pet. And so what I try to do is to work with them in terms of developing logical course, not only traditional veterinary care, but also a round of diagnostics, Dr. Dobias, that makes sense for that individual pet, that individual lifestyle. And then based upon those diagnostics, based upon the science, then I try to work with those owners to go ahead and build what you and I describe as an integrative care plan for those pets, not only dealing with their current quality of life, but also their longevity.
So, Kevin, if I understand well, basically, you don't only focus on what you can do, let's say, with using rapamycin, which we'll talk about, but also give them a roadmap, some sort of easy way to understand what they can do and kind of bring them on the level where they can actually make much difference themselves and just kind of be the guide, as you said, and the partner in the whole process.
Absolutely. I mean, my journey through the human medical care profession has taught me that we all need to be our own doctor. And I don't take that from a prescription perspective, but the reality is we need to be our own decision makers. And I think that extends both to humans and to pet parents as well.
I couldn't agree with you more because, one of my biggest kind of goals and also passions is to kind of educate people to the point where they can make the best decisions and where they can understand and recognize a solid advice from an advice that may need a second opinion or is not as solid. So I'd like to actually kind of transfer to another topic, and that's the use of rapamycin. Rapamycin, as some of our listeners know, is a substance that was, or drug that was discovered in Rapa Nui in Easter Islands. And then by sheer good luck, was not forgotten because it was transferred to Canada and then the Canadian lab was supposed to be closed and rapamycin was supposed to be discarded. Since then, it actually has become one of the most prominent medications, not only on the level of helping people with transplants, organ transplant, to actually prevent rejections. But now it's been researched on the level of longevity and extending health span and lifespan. So what did initially draw you to exploring the use of rapamycin in dogs?
My journey in this field began at the age of about 45, so almost 2 decades ago, when I was diagnosed with a pre-malignant condition. And I ended up jumping through hoops, not only at a local level, but also self-referred to the Mayo Clinic and had a number of different invasive tests done. As a result of that diagnosis, I devoted a great deal of time and energy to the study of aging and that the integrative care of how to reduce inflammation, the syndrome commonly known as inflammaging in my body. Mm-hmm. I saw very close parallels between what I had learned about my own health and what I saw on a daily basis within my veterinary practice. The aging dogs who came in with an ACL tear that then developed a bad back as a result and were put on NSAIDs. Mm-hmm. And so we ended up running into liver or kidney problems. And what I learned along the way is that I really felt like there maybe was a better approach to integrative care of a geriatric patient. And so the hard part, as you suggest, is that most research within the veterinary field is driven candidly by biotech companies, by pharmaceutical companies, because of the expense. Much of my initial research, Peter, was done simply as a trickle down from the human side. There are many smart and talented folks, the Peter Attias of the world, the Matt Caberlins of the world, who are actively researching some of these longevity approaches in human medicine. And then what I tried to do is apply those approaches to the best of my ability to my patients. And certainly rapamycin has received a great deal of attention over the last 3 to 4 years. And we can speak in some detail about the science behind it, but the reality is that it seems to be fairly well substantiated at this point in time that across a variety of species, it has the ability to extend lifespan anywhere between 8 and 17 or 18%, with a good safety profile behind it. And there are many questions that we have yet to answer in terms of optimal dosing, when best to start, how long to use it, etc. But in my hands, if I can offer caring pet owners a safe product that has been proven to extend lifespan in other species, even if I don't have all the answers, if these folks want to make that investment in their pet, it's a logical approach to helping extend that health span.
And sometimes there's nothing else left or there's nothing else offered. You know, I will share with you that I have not really used rapamycin extensively in part is mainly because I'm not practicing as actively as I did. But a friend of mine has a dog that was diagnosed with mast cell tumor about 2.5 years ago. We put her dog on rapamycin on a weekly basis, and the tumor has not changed. It has not grown. The dog is happy, and it's just really fantastic to see that, you know, he's definitely prognostically and overall doing better than most dogs with this kind of tumor if they weren't treated. And as you said, there's so much to explore and so much to learn, but someone has to start doing that. And I'm very grateful, Kevin, that you've been actually kind of pioneering the journey when it comes to practical use of rapamycin. So could you walk us through the primary mechanism by which rapamycin works in dogs and in people or mammals in general, especially in relations to aging and chronic diseases and how it works in the body?
Well, I don't know if I would count myself in the number of those people that know for sure, to be honest, because I don't think we have those answers in dogs. But I think that we can draw from some of the work that has been done not only in humans, but also in smaller mammals. And there seem to be two distinct hypotheses, Dr. Dobias, when it comes to how rapamycin helps to minimize aging, or better phrased, how to extend that health span for our patients. Number one is the fact that it is a broad spectrum anti-cancer agent, as you've spoken about. And that's well documented in vitro in laboratory studies. And there's emerging evidence for its benefit in many types of cancer. Why do I start with that? Because at my advanced age, I've been told most humans, and therefore most pets, probably have small tumors, small malignancies developing in their system at all times. And the frequency and severity of those microtumors, so to speak, increases with age. And the predominant value of rapamycin at this point in time, it mitigates, it interferes with the development of those microtumors. it increases the cancer-free interval. That's one component of the health benefits of rapamycin. The second component is that it's pretty clear that it has pronounced anti-inflammatory benefits as well. Then Dr. Matt Kaberlin's original work coming out of University of Washington from a few years ago also showed that that rapamycin was physically able to reverse the changes associated with cardiomyopathy in large breed dogs. And I know of no other drug to date that has the ability to reverse the changes of cardiomyopathy. It is interesting as well, and I don't think people have figured out the exact mechanism, but it also helps to retard the development of periodontal disease. It's been shown to reduce geriatric hearing loss. And so it's a fascinating drug, one that we don't have all the answers to.
Yes.
But the reality is that it seems like it's so safe and has so many benefits that I think it deserves consideration when we start reaching towards the care of these older pets.
I also find the research fascinating because the Cumberland study says that the cardiac cases in older dogs that have been obviously in advanced stage of life have improved. But then some studies say that the middle-aged dogs and younger dogs, the changes were not as obvious. I think that there's a lot to learn. And I know that there is another study going on right now in a longer-term study for rapamycin, correct?
Correct. That's the Dog Aging Project, which developed, I believe, out of Dr. Kaberlin's. Well, I believe he's a pet owner as well. Let's set that on the table. But I think he was interested in what he perceived the benefits to the study of rapamycin back up at the University of Washington. And so he's looking to broaden the knowledge base there and also to see how many of the results of his study could, in theory, be applied to humans. Because the one advantage we have when it comes to using dogs as an experimental model is the fact that, for better or for worse, our dog's lifespan typically varies between 8 and 15 years of age. And so it compresses that timeline that for people would sometimes last 60 or 70 or 80 years. So I think that without putting words into his mouth, I think one of the goals of Dr. Kaberlin's study is to be able to look at the lifelong use of rapamycin and see what benefits it potentially holds for human therapy as well.
You know, for all the listeners, I think it would be useful to also say that rapamycin is an mTOR inhibitor, and mTOR is a protein, right? And the protein actually seems to participate in inflammatory reactions and somehow takes part in organ aging and cellular aging. And when we inhibit the mTOR by rapamycin, some of the research says that it actually kind of almost mimics the state of fasting, which we know in a healthy body actually promotes regenerative and restorative reactions in the body. So it's really cool on that level. So in your experience, what are the most significant health improvements that you observed in dogs treated with rapamycin?
Well, let me circle around to what you mentioned about mTOR and fasting, because I think you and I have read the same articles and that rapamycin does mimic the benefits of fasting in many respects. But taking a pill or two a week is much more palatable to my own personal dogs than any mention of fasting. Let's be clear. They are not on board with fasts, regardless of the long-term benefits. And so if there's a trade-off to be had in terms of pills, my dogs vote for pills instead of fasting.
But wouldn't it be interesting actually to do a comparison and see? And I hear you. This is one of those areas. If we ask our clients to fast their dogs, like I would just say that 95% of them will just kind of turn around and go the other way because, you know, food equals love, right? And how can we deny our love for our dogs? Like it's just impossible.
I'm clearly guilty of the same thing. The background noise that you might hear are two dogs snoring on the bed. And so far be it, I'm not throwing stones at anybody when it comes to spoiling their pet. But I think that, as you suggested, Dr. Dobias, the reality is that, to the best of my knowledge, the only intervention that has been absolutely proven across species lines to reduce the rate of aging in every species study to date is, in fact, caloric restriction. And so the fact that rapamycin mimics that physiologically, of course, that's the feather in rapamycin's cap. But if you and I look at the most basic way to improve our health, the most basic way to improve the health of our pets, the reality is that fasting should probably play a role.
And eating less.
Yeah.
You know, this topic has fascinated me for more than a decade because I remember some time ago, I was thinking, so it almost seems that there's a certain amount of, our body's programmed to consume certain amount of calories. And when we are done consuming those calories, we're basically done, right? So that's an interesting one. It doesn't necessarily mean that we should starve ourselves and not to be nourished. There's a certain balance and an optimal point, but it definitely seems that when we eat less and when we stimulate the body to stop and cleanse and not to be burdened with digesting food and the food intake, then it does have time and capacity to actually restore and regenerate. And I think that evolution has led us to being that way because, we didn't always have food readily available like now. And the mechanism is actually probably has been there for millions of years. And it's actually common to worms and mice and dogs and humans, which is really interesting as well, right?
Absolutely. Absolutely.
So I'm sure that you've been faced with skepticism and concerns that some people may have regarding the use of drugs like rapamycin. How do you deal with that? And what are the biggest challenges that you see in that area?
The objections, they range from the practical to the ethical and, in fact, the religious. From a practical perspective, the price point of rapamycin is not cheap. I mean, it's basically $100 US per month per patient at current dosing recommendations. So that adds up over time. And it's difficult because there are no cheap sources of quality rapamycin. And, as an example, when we have ours formulated, we send every batch off to an independent testing lab just to verify that we are, in fact, dealing with pure rapamycin without contaminants. And you can buy rapamycin, quote unquote, from India or from China or whatever, and many folks do. I found evidence of lead within a sample that I had purchased from India just on a
trial basis,
trying to investigate what the options were.
Yes.
I found evidence of lead in one sample and of benzene in another, and neither of those are going to add too much to longevity. I don't want to go down that rabbit hole, but suffice it to say, from a practical perspective, we have the concern of economics. There's a subset of people who say, well, gosh, I don't want to use drugs to extend my pet's life. I will rely on exercise, I'll rely on lifestyle habits, I'll rely on natural supplements, but I don't want to go down the pharmaceutical road. And I understand that. I guess one of the things that you and I both became very cognizant of as we went through clinical practice was there are times to take the lead in a conversation and say, well, this is what your pet needs. But there are other times, Dr. Dobias, where I think we would agree that it's best simply to lay out options and let an educated, let a caring pet owner make those decisions for their family. That's really the role that I perceive as part of a consult. I learned that a patient is suffering from these 2 or 3 or 5 different issues. Part of what I try to do is say, well, listen, rapamycin could be an approach to solving some of them, but so might that visit with your regular veterinarian for dental care, or so might another prescription drug or a supplement like curcumin, for instance, that might be a benefit for them.
Makes sense.
And then I have been approached by folks from a religious perspective, too, who believe that it's God's will. You and I and our pets live to a defined length, and that there is something that they perceive as disquieting about trying to alter that. And as somebody who's tiptoeing back into religion after a long period of agnosticism, who am I to argue with that? At the end of the day, if one of our primary goals in life is to be educators, the reality is that education can take many different forms. If at the end of the day, somebody walks out of a consult with you or with me and says, I choose not to do that, but I'm glad that I know that option exists, then we've had a good day.
And this is exactly it. Like some people, it's not an approach that is applied to everyone, but no matter what we do, I think that we affect the quality of life and the length of lifespan and health span of our animals and our own. I like the kind of semi-empowered model that we know that life happens and we can't really fight it. And especially when it comes to some sort of artificial enhancements that some people do just to give themselves an illusion of better health in youth, like plastic surgery or Botox or something like that. But when it comes to real metabolic changes that we can actually influence. I really like the idea of at least to explore it and inquire about it. And as you said, everyone decides whether it's for them and for their animal friend or not, but it's really nice to have the options. And I think that the value of getting a few extra years with our dogs, like most of us would be willing to actually sell everything and give up everything just to have extra years with our dogs. And you can see that it happens sometimes in ways that are not even sustainable, whether emotionally or financially, when it comes to chemotherapy, when it comes to just kind of like holding on the last branch of life by really trying different methods that we know have not really worked. So knowing that rapamycin is capable of extending health span and lifespan, obviously it's been researched and it's going to continue to be researched, and it's really awesome.
There have been instances where pets on rapamycin with cancer have lifespans that exceeded all norms. They're way over at the right end of that bell curve. I have a dog named Joey out of Iowa who has been dealing with oral melanoma for 3.5 years now. His projected lifespan was 6 months at a local oncologist. I have other dogs with bladder cancer that have lived double and treble the projected lifespan, again, based on their oncologist. You and I both understand it's wonderful to think of those individual cases, but they are very much anecdotal. I would love nothing more than if every cancer patient had an extended life with response to therapy. Mm-hmm. And clearly that's not the case. I do not see that, although I wish that I did. And for instance, the limits of rapamycin therapy were demonstrated when a meta-study was performed, showing that rapamycin had no benefit in the care of appendicular osteosarcoma in dogs. So that was a disappointment to me because UC Davis had invested a fair amount of time hoping that there was a benefit there. And so I think that we're learning on a case-by-case basis. But in general terms, what I would say that for the people who are looking for a safe and easy way to help ease their dog's journey through cancer, I think rapamycin remains an option. I think if you're dealing with chronic inflammatory disease like spinal conditions or other neurologic disease, I think rapamycin remains an option for these pets. And there are things that I have found that it does not work for. I don't think that it works very well at all for senility, for the canine cognitive syndrome.
You didn't see that working well?
I did not. And to me, that points out, Dr. Dobias, that there may not be a strong inflammatory component of the senility syndrome. Yeah. There might be other pathologic changes going on, because I think if we look at the anti-inflammatory benefits of rapamycin, logic tells us then that the higher the component of inflammatory disease within a syndrome, the more effective it will be. But there are other diseases like degenerative myelopathy, for instance, that I really haven't seen as much improvement as I would like. I will finish this little segment by saying that I take the very same rapamycin that I sell, out of the very same bottle, in fact.
I was going to ask you if you take rapamycin because...
I do indeed. I've been taking it now for over 5 years. But people whose pets have been on rapamycin sometimes ask me, well, I'm not seeing any symptoms from the outside of it improving their overall health. And one of the replies that I give them, Dr. Dobias, is the fact, well, I take rapamycin once weekly myself, out of the very same bottle that I send your pet. And I don't feel any different when I take those pills. I don't feel like I can go out and jump over a tall building or stop the speeding locomotive. But I am a believer in the science. The science to date shows clear benefits of rapamycin in terms of anti-inflammatory, in terms of the anti-cancer benefits that through to longevity. Until that science changes, I'll take rapamycin.
Yeah, I would like to emphasize for others that there are many of the health gurus like Dr. Peter Attia or, other people who are taking rapamycin as well. And they're very public about it. And I think it's super important for some people to be the early adopters and maybe, making themselves a little bit of a guinea pig to kind of see what changes there are, right? And if there weren't those daring people who explore the unknown and the continents of health, I'm just going to call it, we would not make any progress. So I think that this is really fantastic. When it comes to the cognition, I know that there was a study of rapamycin that suggested that there was a subjective improvement of cognition in dogs. But it's also good to hear or interesting to hear that you haven't seen that. And it's also to kind of point out and emphasize that a drug like rapamycin is not the end all and be all, that there's, for example, omega fatty acids that have improved the cognition and overall mental health of many dogs and people, or nicotinamide mononucleotide M&M I've seen that actually improving behavior and sleep and mood and the level of happiness in older dogs too. What are the most common misconceptions about rapamycin in veterinary medicine that you encounter?
The two answers that come directly to mind are the fact that, unfortunately, the vast majority of your colleagues and mine, Dr. Dobias, are relatively ignorant, I think, of approaches to longevity. And listen, I could be wrong in everything that I believe and everything that I have spoken to you about today. But the current science suggests that there are ways that you and I can improve the health span, can improve the longevity of ourselves and our pets. And I want to do everything I can using that science that's available. And so on the one hand, I would say that my frustration with the veterinary profession sometimes lies in the fact that we're not as open as we could be to alternative approaches to benefiting our patients. Setting that aside, the concern that I have about rapamycin reducing a pet's comfort on a daily basis and undoubtedly their lifespan simultaneously. I've seen so many cases of obesity or lifestyle changes that were impacting a dog's ability to get around. Again, these are things that people can address very cheaply for them. Well, maybe not cheaply with a dental perspective, but the integrative care of a painful pet. The simple things that you and I can do as veterinarians to help our patients improve. Those are the low-hanging fruit for every caring pet owner. You don't have to reach for a $100 a month drug. There are many ways to extend your pet's lifespan without the use of any drugs, just simply by taking a critical look at interact with your pet and their lifestyle.
Why do you think our profession is not open to exploring the new horizons more?
I don't think our profession is any different from the medical profession or from the accountancy profession or whatever. I mean, when I went through veterinary school, probably the very best time of my life, and we learned what was state of the art then. But then you get into clinical practice and much of what you learn becomes rote. You and I probably were at a point in our lives where we could spay this dog, or neuter this dog or remove a mask. Or speaking for myself, sometimes I lost the ability to go home at night and hit PubMed, try to learn additional approaches. It's common when you get into veterinary practice to see the routine diseases and you know how to have, you have treated those diseases successfully dozens of times. Why should you change right now? But I think that as science does evolve, I think that we all have a responsibility to our patients and to the profession to go ahead and evolve as well. And so I think it's an interesting time to be a veterinarian, but we just urge everybody out there to maybe take a look at longevity instead of fighting so many fires.
I'm going to be a little personal because after being in practice, I graduated in 88. So 2 years after you, we are the same vintage, basically. I have faced a few kind of points in my work where I felt somehow stuck or uninspired. I felt that I wanted to explore and learn more. So, whether it was nutrition or homeopathy or herbology and supplement formulation, just every time I felt like I was stuck, I wanted to learn more. And just recently, I listened to podcasts on happiness, and I don't really know who it was by, but they said that there are only two sources of happiness. And one of them is joy, just pure joy of whatever we are doing. And then second one is learning. And I just so resonated with the idea, with the thought, because I think that once we start learning again, or once we make ourselves to learn something new, it just kind of gives us this, it's like a fuel to our life and to everything that we do. And so I would encourage everyone, and I can see that you're doing that, but I would encourage everyone to continue learning and finding something to learn, whether it's language, whether it's medicine, whether it's, anything. And I think that's why our community has been growing and people really find it fascinating, not only for the obvious reasons of making our animal friends living longer and healthier lives, but also for the joy and happiness of learning. And it's really cool. So,
what are your current passions? What are you learning right now?
Right now, I'm learning about your work and how you use rapamycin. And
setting that aside, what excites you these days?
We're just about to launch a new mobility support. It's a fermented supplement. It's a very different carrier media. So it's like almost like an almond or nut butter consistency, and it's fermented. And there are not many supplements and companies that make fermented supplements. So I'm really excited about being able to be part of the process. What else? Oh my goodness. Nature in general, I look around and I never stop being amazed how amazing nature is. And I just try to kind of learn and copy from nature. And third, I'm really excited and sometimes really frustrated with us as a species because we are so hard to understand. Humans are so hard to understand. So the only way I kind of deal with that is to try to learn about why we are the way we are, whether it's, myself or others. Why do we respond and react? And it just kind of keeps me on my toes. And it's kind of exciting as well. We talked about the veterinary community perception of rapamycin and so on. Has there been evolution on that level? Do you have more and more colleagues contacting you or asking you about rapamycin? How does that work?
I think there is a gradual evolution. There's a younger generation of veterinarians that are coming into the profession that haven't been as indoctrinated with the veterinary dogma as perhaps I was back in the day. And I think likewise, there is a population that, us baby boomers, again, as that 63-year-old, I don't remember exactly where I fall in that baby boomer generation, but suffice it to say that longevity is a little bit more pressing concern these days than it used to be 20 years ago or 30 years ago. Profession to veterinarians in that regard. And I think that it bodes well for their patients longer term.
I'm going to be 60 virtually in a few weeks. And I'm not sure how you felt when you were turning 60, but 50 was really easy. And 60 suddenly becomes wow, 60. How did it happen? Right. Yeah. And there are some people who start mentioning, you should make sure that you enjoy the rest of your life and, all I go oh, wow. So, but I think that at least my goal in the whole process is to do my best not to worry about what's going to happen in 10 or 20 years, but do my best to actually do everything I can to improve our health. This is the kind of collaborative learning process. Even we collaborate with our dogs to help them to live longer, and they help us to live longer and all that stuff. So what advice would you give to pet guardians considering rapamycin for their dogs, and how can they connect with you?
The advice that I would give people is to consider rapamycin as just one approach. I think that there are approaches that they can learn from your example, Dr. Dobias, with your attention to diets, supplements, and lifestyle, et cetera. There are very simple ways that you can make a big difference for your pet. Working with your veterinarian, appropriate diagnostics, appropriate dental care, et cetera. That's huge in terms of extending not only the quality of life, but also the health span of your pet. Mm-hmm. But there are resources out there if you want to take a more aggressive stance at this. Take an evidence-based approach to individualized care for a geriatric patient. Dr. Dobias is a great resource. I run a couple of websites, naturalpet.health or helpingpetslivelonger.com. And through those websites, we can set up a concierge consult that will enable us not only to better understand exactly where your pet is right now, but also where they might be headed and how best to intervene. Mm-hmm. But at the end of the day, I'm happy to answer any questions I can for your clients. You can post my email links as part of this conversation without any problem.
And, it's like this just like another tool in a toolbox. And I can see that using a rapamycin is something that will definitely be the focus of many people in the future. And we'll learn more and we'll see where it's good and useful and where it may not be as much. But it's really nice to learn all this. And I'm sure that my community and our community will appreciate it. And I also know that you have another website, which is rapamycinfordogs.com, correct?
That's correct. That deals specifically with rapamycin, yes.
Now, finally, is there a message that you'd like to convey to the pet guardians in our community about health or rapamycin use or anything in general? Is there a final message?
I guess my final message is that it's never too early to start thinking about the longevity of your pet. Find a good veterinarian. Find somebody that you can trust. Find somebody that you can have a conversation with to help you through the dental care and logical use of vaccines and logical use of drugs or diagnostics or whatever, because an accurate diagnosis is the basis for any discussion that you and Dr. Dobias will have longer term.
And there are so many other resources, right? Just for everyone else, I would like you to look into the interview with Dr. Laurie McCauley on mobility and how important it is to promote longevity. Hormone-sparing sterilization by Dr. Linda Brent, just recently published as well. So there are so many different aspects, obviously reducing vaccination, nutrition, how to make sure that there's nothing missing in our dog's diet. Thank you so much for your time. It's been such a pleasure. I hope this is not the last conversation we have. And I look forward to future meetings. And if anyone has questions, can they contact you through the website?
Absolutely. Happy to help. And, Dr. Dobias, as we alluded to earlier, education takes many different forms. And you're inspiration to all the schmoes like me out there just trying to help one pet at a time. So thank you for all the work that you do.
You know what? I think that I must respond to your last statement. I think that we all are learning, and I definitely have learned a lot from you. So thank you.